Hello. Student suicide is a silent, preventable epidemic. Day in and day out, we read in newspapers students committing suicide somewhere in India. But an important fact here is these student suicides are preventable if we know the warning signs and the factors that lead them to commit suicide. I'm Dr.G.B.Sattur, and you're on Lifestyle with Dr. Sattur. The students who commit suicide normally fall into the 15 to 24 years of age group. It occurs in both girls and the boys. There are many causes for suicide in these students. It could be love affairs, financial issues, socio-economic issues. But most concerning that we would like to discuss with you is educational pressure, educational tension, competition, and academic stress. This is probably the highest toll taker. In recent times, we have noticed that more students die of suicide than the farmers' suicide. And new addition is the cyberbullying. Because in the medical colleges, engineering colleges, many universities, hostels, bullying and ragging has become common, but now it is cyberbullying, especially with the girls. Deepfake or morphing the pictures can have a devastating effect. One's sexual orientation as a young person can start. The lesbian, gay, or bisexual. These confusing thoughts can also appear in a young mind. Suicidal thoughts are acts or signs of extreme psychological and emotional distress and unbelievable anguish. Suicide is not a normal reaction or a response to any given stress to the student. And it is also not an attention-seeking behavior by your child, nor is it a threatening behavior when he or she says, I'm going to die. And students these days must have to enter into fierce competition to gain admission into the top colleges and the universities. And the number of top seats are also very less. This is literally a pyramidal structure. More top you go, lesser seats in niche institutions in the country. And hence that increases competitiveness. And I call this as pathological competitiveness. It is not physiological in most of the students. And that harms their mental ability or mental strength itself. The examination system in India is exam-centric, or the education system is exam-centric. Do well in the exam, score highest marks, and go into the top college. And moreover, the Indian system emphasizes on memorizing, on by-hearting the subjects. This is also called as rote learning, R-O-T-E. That means you repeat something until you remember rather than understanding it. So this memorizing, by-hearting education system can be a stumbling block for somebody intelligent, wants to be innovative, wants to be research-minded. This is very important to realize. And students nowadays frequently attend the private tuition classes in the evenings. So they have their regular class, then the tuition class, eat half-hearted dinner, are not able to sleep well, and not eat well. So this all leads to a lot of psychosomatic stress, as we call it. And on the top of it, in many Indian families, there is what I call log kya kahe syndrome. We are more worried about what people are going to talk about my children, and it frequently makes the children to take, for example, a forced choice, and they are not able to speak up. And this log kya kahe syndrome occurs when especially family has very well educated people belong to a certain higher socio-economic status invariably. For example, there are 3 children, 2 boys and a daughter. Both parents are doctors. Both sons are doctors. But the daughter, pressure could come, you also become a doctor. We get known as a legacy doctor family. But the girl is not interested to be a doctor. She wants to be an architect. So the freedom to express by children is equally important. And with the tuitions and media, phones, the extracurricular activities, sports have come down frequently. But at the same time, one gets attracted towards the physical staying also, because as we know, girls mature by around 12.4 years of age. It was so, but now the menarche age has come down to 11.9 years. More and more younger girls at a younger age are starting their menstruation. And equally true amongst the boys. The male signs of growing by age, for example, by mustache or beard, they all start younger. And due to hormonal changes, their voice changes, their behavior changes. Now, all these have to be recognized by the parents. On the top is the financial pressure for the suicide and emotional neglect. What is emotional neglect? You have 2 sons. The eldest son is a rank holder, is a top guy, and the younger one is more interested in games, does do good games. But instead of asking him to be a sportsman, you tell him, look at your eldest brother. He's so good in studies. He scores a rank. You are useless. You don't study at all. So this sort of emotional neglect can really affect that young mind. But there are warning signs by the student before he commits suicide. Students start feeling hopelessness, low self-esteem, withdraw from family and friends, don't attend social functions, start driving recklessly, or self-injurious behavior like cutting onto the forearm with a knife, disturbed sleep pattern, and talking or thinking about suicide most of the time. And some students or parents have unrealistic expectations in that he doesn't want to see the blood and become a doctor, but somehow wants to become a doctor, although he could have got an excellent scoring in economics or have done a PhD, for example. So these sort of confusing, conflicting behavior, unrealistic expectations at times can occur in children, and poor coping strategies, because most of the time we tend to spoil our children. If we ask 500 rupees pocket money, some of us end up giving 1000 rupees pocket money. Then of course there are certain poor coping strategies. There could be jealousy, and there are certain medical conditions like, say, bronchial asthma. The boy is intelligent, the girl is intelligent, may not be able to read because of the breathing problem. So medical conditions, and then mental disorders, they all can affect one's learning. There are solutions to prevent the suicide in young ones. It is empathy, understanding the child, giving words of comfort, and encouraging words. Empathy is needed and not sympathy. A lot of difference between them. Empathy is being in his or her shoes and actively involved with an emotional connect, while sympathy just expresses concern. Be involved with your child. Once your child, son or a daughter, is about 15, 16 years and above, treat him like your friend. Otherwise, he will not discuss intricate personal or educational matters. Parents have a huge vital role to play. You can tell your child, it's okay, this happens to everybody. and you can cry if you want to. We can discuss anytime you are free, and you could choose any other course if you want to. We don't expect that you continue in the same course. Using short words and responses to your student or your child is important. Don't try to give him a lecture or discourses for hours. Don't talk of philosophy to him, which is not in a mood to understand. Be short. Allow him to express what is making him to commit suicide. And of course, the coping skills are very important. They can be taught in the school. He can learn on the media, on the internet. Parents should also learn certain skills, better parenting skills, so that they can be with the child all the time when he needs help. Then, of course, substance use. Has your child's behavior changed in recent times? Has his company changed? Does he remain moody? Does he go into the room, locks himself up, and then start to talk on his mobile? Keep an eye on his mobile. If he is young, like 15, 16 years of age, and once in a way check it. And school should also be provided for helpline numbers, arrange seminars about increasing the moral strength of students. Contacting the psychiatrist is extremely important. Seeking professional help is important. So, suicide in a young adult, in a teenager, in a college, university going student is highly preventable. As parents, as teachers, as society, there are signs that we can recognize in these students. Don't forget to ask for a professional help. Even there are certain governmental helps available all the time. Ask a psychiatrist or your own people. Make certain your child is allowed to express his or her feelings to you as a friend. Don't give up on the people you love. Hope is real. Love is real. Have a happy family life. Thanks for watching.